Hi, my name is Barrett Kirkaby. I'm the owner of Body Mechanics Orthopedic Massage. I wanted to talk to you a little bit today about some of the really important changes that happen to a pregnant woman as she goes through the course of her expectancy. Some of the things that we look at posturally in terms of massage are the spine changing as you move towards the end of your pregnancy. Pregnant women start to secrete a hormone called relaxin. It's in preparation for birth, and it helps them regulate a number of things in their systems. But one of the really important things that it also does is it softens the connective tissues and sometimes the joints and the discs. Anything that's fibrous, it softens that in preparation for birth. And so you end up with joints that are a little bit overmobile, and basically they're preparing for things to open, change, and move, which is great, but not so comfortable a lot of times for pregnant women. So we're just going to quickly look at the spine and talk about some of the changes that happen. Because things are becoming overmobile, you have the lumbar spine, which is that area from here to here, and it's going to move forward. And the reason that that's going to happen is you have the weight of the belly pulling forward, so you now have an increased curve here like this. And the spine is this amazing piece of equipment, but it has to mirror itself in order to balance. It's sort of this little bit of a game of Jenga. And so to accommodate this forward movement, the thoracic spine also pulls back this direction. So now you have a movement this way, and you have a movement this way of the thoracic spine. Now, that's not such a huge deal, but some women experience headaches, back tension. It really depends on whether it's the first pregnancy, second, or third. Subsequent pregnancies, this action happens a little bit faster. The other thing it depends on is what kind of work you do, what kind of activities you do, because as the spine pulls this way a little bit, the shoulders roll forward. So we end up with this parabola like this. And to balance itself, however far in one direction it moves one way, it has to move the other way. So we end up with these lovely increased S curves, which are super, super healthy, but that is signaling change in the body, and changes can cause muscle pain, headaches, tension, all kinds of things that a pregnant woman might be surprised that she has. Massage can really help to relieve these things. We can reset the muscle length, we can just get the muscles soft and loose and get better circulation in there and make a pregnant woman a little bit more comfortable. One of the interesting things though is if you have had tension headaches previous to your pregnancy and you start to secrete relaxin, sometimes actually the headaches improve because now you've got these soft, loose muscles, and if you had migraines before, sometimes we can find in pregnant women that those symptoms relieve themselves, but you get a whole bunch of other ones. The other thing that happens is we're going to look briefly at the pelvis. As things start to soften, the body sort of has this response where it really wants to create stability because you don't have these really hard fibrous connections anymore. So the body sends out the signal that, oh my goodness, things are really, really loose. We had better tighten up because something's got to hold the system together. So when we're looking down here at the pelvis, which is getting nice and loose, there are some muscles that run from the sacrum to the femur, and also ones in the belly and in the lower back. And those muscles, in order to try to hold things together and stabilize, will tighten up. So a lot of pregnant women, they experience back pain in this area right here. The muscle looks a little bit like this, right? Runs from the last ribs to the top of the ilium, and it's called the quadratus lumborum, and it will try to tighten up, especially as that curve moves this way. It'll shorten up, and then the second muscle that pregnant women often complain about that is affected by this change is the piriformis. Now the piriformis runs, I'm just going to turn Lucy here for a minute, from the front edge, so that's the belly side of the sacrum, like this, to the top of the femur. And as it wants to stabilize the pelvis, you get this drawing back action. It's really trying to hold this stuff together. And so oftentimes you'll see that duck walk with pregnant women. It's going to move this bone around that way. And It's also not so much of a problem, except it can be really, really painful. And one of the features of the piriformis muscle is that there's a foramen, a hole, that runs through it, and depending on your anatomy, it's just purely based on genetics, the nerve that feeds the leg can either run exactly through that muscle or just underneath it. Now, if you have issues with it, it's just based, like I said, on just sheer luck of your anatomy. If that foramen is very small, it can be compressed and you can get sciatic-like symptoms. And we see that a lot from pregnant women. That's what they complain about, especially during the later times in the pregnancy as things get a little bit more intense for them. We want to talk to you a little bit more about some other issues that happen in pregnancy, but this is all we have today to say to you. We hope you enjoyed our video and you found it informative. You can find out more about us at bodymechanicsnyc.com. Thanks, and thanks for listening.